Welcome to day 3 of our vocabulary challenge. Today's theme is medical and hospital vocabulary. This was one of your most requested topics. Once again, you can download the free PDF for this lesson by clicking on the link in the video description and entering your email address. We'll start with a couple different places in the hospital. There's the ER, which stands for emergency room. This is where the most urgent conditions are treated. You can go to the ER yourself or be brought in by ambulance if necessary. If you can't walk, they'll carry you on a stretcher. The OR stands for operating room. That's where they do surgery. Things in the OR have to be sterile, meaning free from bacteria. Then there's the ICU, meaning intensive care unit, where patients with the most serious conditions stay with extra monitoring and help from doctors and nurses. A number of tests can be done at the hospital. Some basic ones are measuring your temperature with a thermometer and checking your blood pressure. It's also common to take a blood sample and a urine sample and send them to the laboratory for analysis. Some more advanced methods include an ultrasound, which uses sound waves to make an image. This is typically how they check the baby inside a pregnant woman. There's an X-ray, which checks your bones, and a CT scan, which is a more advanced type of X-ray that provides a more detailed image. An MRI uses magnetic fields to form an image, especially of the brain. An ECG tests your heart activity to detect any problems. I think that stands for electrocardiogram. And a biopsy is when they take out a little piece from inside your body to check it for cancer. Based on all this information, the doctor makes a diagnosis, a conclusion about what's wrong, and then will offer treatment. This could be medicine. Some of the most common are painkillers to reduce or eliminate pain, and antibiotics to kill bacteria and resolve an infection. The medicine could be in the form of pills you swallow, a shot you receive, or IV medication, intravenous medication that goes more continuously into your blood over time. If you have a bad cut, you might need stitches to hold your skin together and help it heal. If you've broken your leg, then you'll need a cast. That's a hard plaster covering around it to keep it stable until the bone heals. And you'll also need crutches or a wheelchair to help you get around. Surgery is another possible solution to certain medical problems. There's outpatient surgery, meaning you can go home the same day, and inpatient surgery, meaning you stay overnight in the hospital. For some surgeries, you get local anesthesia, meaning a shot that makes you numb. It temporarily takes away the feeling in that part of the body. And for others, you get general anesthesia, meaning medication that makes you completely unconscious. The medical professional in charge of this is called an anesthesiologist. For problems that affect your bones and muscles, you might need physical therapy, which is kind of like exercise sessions with someone who helps you strengthen that part of the body. To treat cancer, there's chemotherapy, which is strong medicine, and radiation therapy, using high-energy radiation to kill the cancer cells. Someone whose kidneys are not working might need dialysis, where a machine cleans their blood, until they can maybe get a transplant. That refers to putting an organ from one person into another. If someone has had a limb, that means an arm or a leg, amputated, meaning it had to be cut off because of injury or disease, then they might be able to get a prosthetic arm or leg, meaning one made out of metal or plastic that can still help the person have use of it in daily life. Finally, when your hospital stay is over, you are discharged. That means officially released. Now you know a number of useful hospital words in English. Remember to download your free PDF guide to review this vocabulary and tune in tomorrow for the next lesson in our 100-word challenge.